Today, I'd like to give you a little firsthand experience with Christian Healthcare Ministries, which is something my wife and I have belonged to for probably the past 4.5 or 5 years, roughly. We've been very happy with it, but we recently had our first experience where we had to turn some things in for a fairly expensive procedure that I had done on my eye. I had a retina surgery. I had a melanoma on the retina of my right eye, and I had a retina surgery, which, if you include everything, the cost of the hospital, the cost of the doctor, the cost of the anesthesiologist, etc., the total cost of that procedure was $26,534. Uh, this was really our first opportunity to use our Christian Healthcare Ministries in the 4.5 or 5 years that we've had it. And I got to tell you, just to start the whole thing, is that it came through with flying colors. And I just wanted to give you a little bit of a description of kind of blow by blow what happened and how Christian Healthcare Ministries works for us uh, on this occasion. Um, right now, we are gold members, have been gold members since we started. Gold membership cost us about $325 a month. Plus, we pay to a thing called Brothers Keeper, which is kind of like a catastrophic additional insurance that takes you up to infinity. So basically, any issue that we could possibly have, we're covered for up to infinity. There is no limit. Uh, so if I, had open heart surgery that cost $100,000, it's going to get covered. Um, Brothers Keeper costs, I think, another $25 or $35 a month. And then we pay some additional money, which are basically gifts, donations to people who have issues that are not covered, that are CHM members. These are things that were pre-existing or uh, different things that were not covered for one reason or another because of Christian Healthcare Ministries rules. And we donate additional monies to that. So let's say altogether our cost of health care for myself and my wife, she's in her 50s, I'm in my 60s, our total cost is about $400 a month. Um, when we had Blue Cross Blue Shield, because I'm self-employed, Obamacare kicked in, which Obamacare is a disaster for anybody who works for themselves. Um, our Blue Cross Blue Shield, which was terrible coverage, went from about $900 a month, was going up to about $1,600 a month. Um, so in the 4.5 years, just with the difference between $1,600 a month and $400 a month for Christian Healthcare Ministries, we figure we've saved somewhere in the neighborhood of $65,000 just because of that. Um, we've always wondered, well, is it going to cover what we have? My wife has always had a little bit of doubts about it, but with faith, we kept paying the money, and sure enough, they've come through with flying colors. Anyhow, we turned in $26,534 in bills. There is some paperwork that you have to do to get that turned in correctly, but it's all done through a portal online. And you do have to dot your I's, cross your T's, and you also want to go to each of your providers, your doctors, your anesthesiologist, your hospital, whoever you get a bill from, get an itemized bill, and call those people and negotiate the best price you can get for any of those things. I mean, it's like you would negotiate for a car or for a house or for anything else that you would buy. You're actively responsible for trying to get the best deal you can, which I don't mind doing. It's part of what I do for a living all the time, so it's really easy for me. But at any rate, they're very willing to give you a discount when you are basically considered a cash paying customer with Christian Healthcare Ministries as your backup. So anyhow, we were able to negotiate discounts. We turned all this information into Christian Healthcare Ministries, and it took probably 2 months to get completely paid, but we have now received checks payable to us for the entire amount. And it's now our responsibility to pay our providers what is due to them. In most of these cases, what we did is we paid in advance to get some of these discounts because we were fortunate enough that we had the money, and we just went ahead and paid for some of these things knowing that Christian Healthcare Ministries was going to send us a check, which in fact they did. The great thing about healthcare sharing is Christian Healthcare Ministries is a nonprofit. It is acceptable under the Affordable Care Act, so you don't get penalized on your taxes for not having health insurance. It is acceptable. The reason it works so well is because it's a nonprofit company overseen by a board of directors. There's over 400,000 members to Christian Healthcare Ministries, and it is basically there's no overregulation by the government because of the separation of church and state. We are a Christian organization that we pay for each other's health issues. That's basically what it comes down to, so the government is not allowed to overregulate it. There's no kickback to government officials. I guarantee you the healthcare industry pays all kinds of money to government officials to get laws passed that are favorable to them. Health insurance companies' overheads are out of control. They're just ridiculous. And health insurance companies also have the right to determine what you can and cannot have as far as your doctor is concerned, procedures that you can have. This is not true with healthcare sharing. What you do is between you and your doctor. And if your doctor sees fit to give you something or to do this procedure or do whatever, that's between you and them, and Christian Healthcare Ministries or other healthcare sharing organizations will not second guess that. So there's none of that, no second guessing. So it's very good as far as that's concerned. Christian Healthcare Ministries has been in business, I believe, since about 1986. Since that time, they have never not paid a share. Okay, never. Since 1986. So if it's covered by Christian Healthcare Ministries, and most things are, but there are a few things that are not. The things that are not are issues that would be considered like unchristian. For example, if you had an automobile accident while you were driving drunk, they're not going to cover that. Mental health issues are not covered by Christian Healthcare Ministries. If you had a baby out of wedlock, that's not going to be covered by Christian Healthcare Ministries. If you had a drug problem and you wanted to go get treatment for that drug problem, they're not going to cover that. I don't think they cover ambulance service. I'm not sure about that, but I don't think they do. But anything like this issue with my eye, or if you had cancer, or if you have a heart attack, or if you whatever the issue happens, that's a normal issue with your health, they're going to cover it. So for us, it's been very, very good. And on this particular issue, they have paid every penny of what we've turned in, and we are completely covered by it. So it's been a super thing for us, and I highly recommend it. There are about 4 or 5 different healthcare sharing organizations in the country. Not all of them are Christian. There is now a Jewish healthcare sharing organization. I think it's called United Refuah or something like that. So anyhow, you can Google it. It's there. There's Samaritan's Purse. There's I don't know, a couple of others. You've probably heard advertisements on the radio for a couple of them. But at any rate, my recommendation is that you have faith, that you join one of these things, and it can save you a fortune. We're on the gold plan. There are several other plans that are even more affordable than what we pay. They have gold, silver, bronze, I believe, within Christian Healthcare Ministries, and they have varying degrees of rules and what have you. My suggestion to you is you Google it, read it. That's what we did when we first got started on this. Before we joined, we probably researched it for a month. And after researching it for a month and stepping out with a little bit of faith, we decided, okay, this is the thing for us, and it has worked out really, really well. And I would suggest that if you fit into a situation like us, that you take the leap of faith and join it. One thing about CHM, and I think most healthcare sharing, is for each medical issue that you have, there is a $500 cost. You're going to pay the first $500 basically of anything that happens. Like if you break your arm one day, you're going to pay the first $500. If you broke your leg the next day, you're going to pay the first $500 of that. So any issue that you have is going to be covered by that. But I've generally found that even with the $500 that we have to pay, you can negotiate the cost because you're a cash paying customer. The cost of getting it done, if you're paying cash for anything in a hospital, doctor, whatever it happens to be, is less than you think it is because they want the money. Okay, so it's not too hard to negotiate these things and just find out what it is. I'll give you an example. I had a copay for a chest x-ray that I have to get every year, and that copay was, I think, $250 the last time I had one done for the chest x-ray. If you just go buy a chest x-ray for cash, it's going to cost about $75. So there's a huge difference. My recommendation is that you go for it. If you have any inclination towards going towards healthcare sharing, that you do it. It will save you a fortune. That's just my recommendation. Thanks, and have a good one. Thanks. Bye-bye.